Thank you. PS and your team are conferred with immunity in accordance with Cap 12 of the laws of Zambia. Before adjournment, we're looking at issues of infrastructure, maintenance policy. We've looked at issues of kitchens and everywhere, mortuaries and the other equipment which is being used at some of these our facilities. And PS, moving forward, I think what we'd want to for this committee is for you to provide us your robust maintenance policy. If you don't have one, you need to formulate one and tell us how you intend to move forward to ensure that you are up to speed in terms of maintenance of this equipment within our facilities. And our people are in dire need of this equipment, PS. I think we've deliberated on this issue for too long, as it were, and would want that submitted to this committee, as it were, moving forward. If we also, colleagues, look at page 39, moving forward, is poor maintenance of hospital infrastructure. It's the same submission. And PS, we want you to give us now, last time you appeared before this honorable committee with your director of infrastructure. I don't know if he's here, Mr. Muyambango. I even remember his name. Is he here? Yes, Mr. Muyambango, he can take seat swap with Mr. Mbewe. Where's Mr. Muyambango? He can sit where Mr. Mbewe was sitting. PS, we've labored on this issue. It's not only in this paragraph, but also we've made a submission in paragraph 22 on various hospitals, Zambezi Ward, Rehabilitation, Solwezi Central, the incomplete Mwense, I don't know if it's district or first level hospital, so many. And when you appeared before this honorable committee, you did not have a roadmap, and your officer was lost on what to make as submission on the aforesaid matter. I think it's very, very important that we have traction on how we can move forward in terms of this infrastructure, as it were, so that our people in these places, Lukawe Rural Health Center, Chizawombo District Hospital, rehabilitation of Lusaka DHO, delayed completion, Mwense District Hospital, Jafet Mansa District Hospitals. PS, you've made submissions and you've made your submission before this honorable committee. But I think what we'd want to hear, what is the way forward? How do you intend to complete some of these hospitals which are stored at various levels in the country? You can comment on that. Then I'll allow 3 questions from honorable colleagues. Now, honorable colleagues, we are dealing with both infrastructure under paragraph 22 and 23, and this will be our last item when the PS has given us roadmap. And also I would want ZAMSA to give us a roadmap in this procurement of various equipments. How do they intend to ensure that is procured on time, as it were, in accordance with the requirement of the ministry? PS, you can proceed with my question. It's an overall question on all infrastructure and the roadmap and your policy, and then other honorable colleagues, you chip in and make comment. Thank you. PS, you can proceed.
So generally on infrastructure, this year and last year, we concentrated on finishing the new infrastructure that has actually been started, and we have a status in terms of what we have done around the new infrastructure that actually delayed. We should have finished earlier, so we concentrated on that, and the status will be given. Going into the future, we need to look at the old infrastructure that we need to rehabilitate in a very structured way. And some of the biggest problems that we have before I even come to there is that some of the infrastructure is actually quite old, and even if we try to maintain, it gets back to where it was in a very short time. So we need to be looking at replacing some of that infrastructure. And then the second issue also has to do with the type of materials that we've used for certain infrastructure. Like during an emergency, we used, during those emergencies a few years ago, we used to use prefabricated materials. And right now, some of those structures, we cannot repair them because we need to source appropriate materials with which to do that. So we do a mapping of the infrastructure that we need to rehabilitate, and it's possible to rehabilitate it, and then ask for Treasury Authority with which to actually do that. And with permission from you, Chair, I will ask my Director of Policy to comment on resources for maintenance of that infrastructure, which we've asked for going to the next year. Thank you.
Thank you, Director Policy. You can comment, and after you comment, PS, I think I'll give you guidance on what to require, even as you go back and sit, what you require to submit, and also we have timelines on those things when they will be done. And also as ST comes, you also come, we tell him also as well and agree on the way forward so that we can have timelines and we can be ticking this will be done by when, this should be done by when. Director Policy, and I think you can proceed.
Thank you very much, Chair. I think the PS has already said most of the things, but I just wanted to add that indeed issues of rehabilitation for infrastructure is critical. And I think that as a Ministry of Health, we need to really strengthen our coordination between ourselves as a ministry and also the Ministry of Infrastructure, so that we know exactly what is required in each and every province in terms of rehabilitation. Because I know that a certain component of the budget for rehabilitation sits with the Ministry of Infrastructure. That way our response to maintenance and rehabilitation would be more strengthened if that was done. I think going forward, Chair, we need to just sit down with the two ministries so that we are better coordinated. Thank you.
Thank you, Honorable Dak.
Chair, thank you very much. PS, of course, I expect you to be assisted by people from infrastructure. The committee would want to find out how the Ministry of Infrastructure with yourselves are collaborating with regards to quality control on most of these projects that are littered throughout the country. Because we have seen as a committee, when we traveled countrywide, and we noticed that there's a flaw with regards to the supervision and project management of contracts which are under the Ministry of Health, but of course being supervised or being managed by the team from infrastructure. So we'd want to get it from the people from infrastructure. What is it that has changed? Because we made very serious recommendations last year or the other year after our tour of our countrywide tour. So we want to find out what is it that has changed with regards to the project management and the supervision of all these projects which are littered throughout our country, as a big chairperson.
Thank you. PS, you can proceed.
Thank you so much for that question. The Ministry of Infrastructure is actually responsible for quality assurance. They are our quality assurance partner, and on almost all the projects that we actually do, especially the bigger ones, they are actually our official consultants as part of the contractor itself. With that, Chair, I wish to invite infrastructure to further comment. Thank you.
Thank you. PS, you mean Department of Infrastructure?
Yes, they are here.
Okay. I think they can come, they can sit, someone can sit here and comment, but PS, this committee has dealt with infrastructure. And as we speak, infrastructure has got a lot of structures dotted around the southern province, Chikankata, Honorable Chair's constituency, go to Siavonga, which we're inspecting. And we're also asking them for a roadmap on how they can ensure that those structures are completed. So I think what is important is your collaborations with them. Sit with your counterpart, the PS there, and see how you can be helped. I'm sure mostly into maintenance, but moving forward, I think you've got your own department. I think Ministry of Health is the only ministry which is still maintaining a certain level of autonomy in terms of infrastructure, apart from maintenance. I think you have that luxury, I can call it, but I'm sure it's because of how your ministry is set up. Infrastructure, I don't think they will. For me, I think we'll proceed to ZAMSA. We know what they're going to give us in terms of submission. So, Nbodaka, you can make your submission, then we go to ZAMSA roadmap on procurements.
Thank you, Chair. Chair, with regards to these delayed projects, I'm sure PS and the team have sat down and discussed these issues. The controlling officer, first of all, the committee, just briefly give us the status of the stored projects and what is it that you have planned with regards to completing these projects. I'm sure by this time you could have already sat down and you have agreed on the way forward. Briefly, can you update the committee with regards to what I'm trying to get from you? I submit, Chairperson.
Thank you. PS, you can proceed.
Internal infrastructure from, internal infrastructure team from Minister of Health could comment on that in terms of just the status, and then we take it up from there.
Thank you, Mr. Myambango. Do you have the status?
Thank you, Chair.
Or you want us to make a judgment again? You can proceed.
Thank you very much, Chair. As regards stored projects, we do have a process already in place where we are procuring fresh works to complete these same projects. Right now, all we are waiting for is funding in some of the cases, and there are others that are already in place right now where contractors are in the field and working. So altogether, I think as at now, I can talk about 23 that were yet to procure for completion purposes. So, Honorable Chair, work is going on. Thank you.
Yes, we make progress. That's Mr. Myambango's submission through the PS. PS, do you have a last comment? Then we proceed to ZAMSA and then we start to wind up.
No, Chair. Let's proceed. I'm feeling dizzy.
Thank you. You can take some water. ZAMSA, there's a question. What is your roadmap vis-a-vis these hanging procurements for the Ministry of Health? And how do you enhance to ensure that you have timely procurements? We know there are processes and there are certain things also which are impeding, but we give us a realistic lead time on how you intend to ensure that some of these things are mitigated. And also 2025, we've seen some of these lapses. How do you intend to make sure that you mitigate those issues moving forward. Zamsa, I can proceed.
Thank you, Honorable Chair, for that question. The procurement process is currently ongoing. It was floated, open national bidding. It closed successfully. 58 bids were received. They are undergoing evaluation. Even as we speak, a committee was put together, headed by the Ministry of Health Technical Department. They are due to finish and submit their report next week. We anticipate that all things equal and going well, we should be signing contracts with successful bidders on the 10th of January 2025, and the delivery period according to the documents is 12 weeks from signing. Thank you, Honorable Chair.
Thank you, Vice Chair.
Thank you, Chair. My question is to the DG through the PS. What's the position of government in relation to these newly constructed clinics under CDF? For instance, in Chikankata, I've constructed almost 5 clinics, 2 maternity annexes. But when it comes to specialized equipment, it's not easy for us because we don't know. So what's the position of the ministry?
Thank you. PS, there's that question. We are ably constructing for the ministry under CDF and specialized equipment. Is the ministry coming through to mitigate that issue? You can proceed.
Yes, we actually are. What has lacked in the past is enough collaboration, because sometimes clinics are constructed without sufficient interaction, that kind of thing. But that has improved. We have encouraged colleagues at provincial and district levels to interact with local authorities as our plans are being mooted, so that the structures that are constructed conform with what we require as a country. And we also leverage each other's resources in terms of procurement of equipment. So we are improving on that scope, but we are not yet where we need to be. Thank you.
Thank you, PS. Thank you, PS. Honorable colleagues, there's hope. There's hope, and we are building infrastructure. The ministry should also come in, and I think what is important is a collaboration. We are doing a maternity annex. We are doing how does the ministry come in? So if we need to just enhance our collaborations, as it were. PS, we thank you most sincerely with your team. However, as a ministry, you've got a lot of work to do. And I'll highlight some of these issues. First, the issue I was talking about, the issue of infrastructure. We want you, PS, with your team to submit to this committee your strategic plan or your plan in terms of maintenance of infrastructure, sitting under the Ministry of Health, as it were, the maintenance of equipment under the Ministry of Health, the scheduled maintenance when equipment is procured, where it's sitting, when was it procured, because if we don't know where it's sitting, then we cannot maintain it. We don't know when it's even due. All those CT scans, mammograph, whatever you call them, and image something, x-rays, mortuary units, kitchens, just to mention a few. I think it's very, very important that we have a stock of our asset register, equipment, the maintenance policy, the service level agreement, maintenance agreements with suppliers, who maintains what, who maintains where, and the contract duration, so that we are not found wanting when an equipment is broken down. We cannot be talking about UPS for Eastern Province Chipata General for 2 years, and we are failing to appropriate 31 million under our budget. That money goes back. I don't think it's right. It's right. I've given an example in this committee. It's like they lock you in ShopRite and you die of hunger. It's better you eat and they arrest you inside ShopRite. But we come out diagnosis, no, it's hunger, this one has died. In the shelves where there's biscuits and everything. I don't think it's right. So we cannot take back money and then we are talking about a UPS for $50,000 PS. We'll be looked at a generation which was there and didn't make decisions. I think it's important to make decisions, timely decisions, when we can avert some of these sufferings of our people. These members, you look here, they go through a lot. They send money for CT scan, transport, send, okay, get my vehicle, go and pick the patient, take them to Chipata General, take them to Mambwe. Vice versa, Northwestern Province is the same, and that's in the Copper Belt. We've ended up now procuring hearses for ourselves to bury people and facilitate taking them to the hospital, which is not our role. But I think we can collaborate further and ensure that we move together as a unit. There is a lot of construction, like the Vice Chair said, through CDF, mean clinics, maternity wings, clinics, and I think we need to have a multi-secretarial, yourselves, local government, infrastructure. We sit to say infrastructure is provided. Can we now our budget for equipment so that we can mitigate some of these our issues? Because we also don't want to construct a clinic, then it has no equipment and it just sits there as a building. We go there and commission maternity beds. We need a lot of maternity beds. People have done maternity wings, annexes in around the country, dotted around. So those are things to look at. If we cannot measure it, PS, we cannot manage it. As simple as that. ZAMSA, in terms of procurement, I think now procurement has also been simplified a bit. If you want to do direct bidding, it's allowable, right? But let's be a cause. And also issue of delivery period is very, very important. Let's look at the delivery period which is feasible. Then we start trotting around the office of the Attorney General for extension or another extension. I think let's help each other. There are people, Zambian people out there who need the service to be delivered. There are also the executive which needs the service to be delivered, and we're also there to provide oversight, as it were, to see that there's accountability and service delivery. So it's very, very important that you look at your lead time, you look at your planning, and also as you invite some of these would-be suppliers, I think do your due diligence, because you don't want the back and forth. Today you cancel, tomorrow you re-advertise again. And we've seen that also happen in our local authorities, where you have a procurement. They all fail to procure because they find the person. No, the person is not capable. He runs out of sight. It's cancelled. It brings in delay and escalation of cost. Escalation of cost, you know, there's our foreign exchange. It's volatile. There are all these dynamics worldwide, which needs to be looked at, because we are not isolated. We are a global village. So it's very, very important, even as you procure medicines, your supply chain, your delivery. I think PS, those things we need to mitigate. We had issues of delivery of medicines in Shuangandu. I don't know if it's Shuangandu, if I'm correct, the Muchinga or somewhere, where they were back and forth in terms of delivery notes. I think those are things which can be mitigated, PS. And some of these things, PS, are administrative. You've got issues of title deeds, imprest issues, which we've not even looked at. Okay, drawing fuel, government fuel by private vehicles, all those issues. Yeah, ZRI issues, non-provision of tax clearance before payment. Those are prerequisites which I think your accounting cadre, director finance, should be looked at, and you clean up. You are one of the big ministries. It's important that those things are mitigated moving forward. We will do our recommendations, but PS also, we've invited you to come with the ST so that we can extinguish some of the issues together with your chief controlling officer, so that we can make headway moving forward, because we don't want to recommend to give recommendation on things which we've already recommended. issues of payroll. Payroll is almost 50% of our budget. It's imperative that you mitigate those issues. I heard Deputy Director HR somewhere there. If I'm correct, let's mitigate payroll issues. Clean the payroll as a ministry, as it were. So, PS, that is a guidance. What you need to provide, I've mentioned, needs to be provided here. Maintenance policy for infrastructure and equipment. We need to know the way forward. And when ST comes, we will speak about those things and chart the way forward so that we agree on one issue and move forward. As you come with ST, I think also do invite ZAMSA to come so that we speak together and agree on some benchmarks and how we can move forward. So we thank you most sincerely, PS, and you have a good afternoon. Compliments of the season to the entire team of yours. Immunity is lifted. You are free to go. Though those who participated in eating my cake, there's a basket at the door there. You need to pay. It was not for free. So thank you so much, PS, and we do appreciate your coming. ZAMSA, DG, and your team, we are grateful. Our role is not to
On Oyo constituency, we profile one of the most prominent constituencies in the country.
The constituency is facing a lot of challenges, but the major ones are, number one, poor road network.